It is now time to answer some common health questions. Joining me as always is News Channel 5's medical expert, Dr. David Soria, the Chief of Emergency Medicine at Wellington Regional Medical Center. Nice to see you.
You too.
So school is going to start probably in about 2 weeks for some. Run down the list of what vaccinations our kids need.
Sure. So just so we know, I mean, the CDC and the federal government doesn't dictate or requirements as far as what kids need before they go to school. It's a state-to-state requirement. So the state of Florida, and you can find this on Florida Health or even on the CDC website, which I do recommend you do look at because it gives you timetables or age tables. But the required immunizations are as follows: tetanus, diphtheria, you have oral polio, pneumococcal, Hep B, and I think that's about it. So those are the ones that are required. Then there's also a few that are recommended. You have human papillomavirus, varicella, and then of course the influenza flu vaccine. Recommended, but none of those are required.
But the must-dos are online. You can find that information.
And check with your pediatrician as well.
Talk about medicine. Can you take medicine with a grapefruit? Is that a no-no? I've heard of this before.
Yeah, I mean, as delicious as grapefruit juice is, it can be actually dangerous when you take certain medications. What it has in it is something called a furanocoumarin, and that chemical or that ingredient in grapefruit actually disables an enzyme in the liver called the P450, and that enzyme is responsible for breaking down or metabolizing a number of different medications. We've actually identified over 85 of those, and 1 7-ounce glass of grapefruit juice can actually disable that enzyme for up to 24 hours.
So it's not just an old wives' tale.
No, it's really not. It's actually, there's plenty of science to support it. So some of the medications I want you to be aware of can be dangerous. For example, lipid-lowering drugs like cholesterol medications, calcium channel blockers. A lot of us are on that for your blood pressure. As well as antiarrhythmics like amiodarone. That's a life-saving drug. If that's in the wrong concentration in your blood, it can be very dangerous. Please check with your doctor if you're a grapefruit lover.
All right, Dr. Soria, if you have a question for him, go to our website, WPTV.com, click on the health link, scroll down. On the right-hand side, you'll see a form. Write your question right there. Thanks for coming in this week. We'll see you next week.